I was always aware that it can happen to anyone, that patients do nothing to deserve it, they do nothing to cause it, that cancer does not discriminate. But for some reason, I just didn't think it would happen to me. In September of 2019, I had a 3D mammogram 10 months late. I was diagnosed with triple positive invasive ductal carcinoma. It was an early stage, thank goodness. Had I waited 10 more months, it probably would have been too late. As soon as I got my diagnosis, I knew who my team would be. And I didn't want to go anywhere else except Kettering Cancer Care. Being an oncology nurse was a double-edged sword. On one hand, it was fantastic because I had a lot of knowledge. I knew exactly what to expect. I knew what my treatment plan would be before I even saw my doctor. I knew which route I would take with surgery. All of those things were great, but they also were horrifying because I knew what to expect. I knew what was coming. I knew what my treatment plan would be, and I knew it was going to be rough. So it was a very interesting experience to go through it as the patient. And it wasn't long into the experience that I realized I didn't know as much as I thought I did about oncology care. And I wish sometimes I could go back, and have some moments with some of my patients where I was just doing my job and I did a good job. And I would educate and share about their chemo or about side effects to expect. Just another day, seeing another patient. But being on this side of it really changed my perspective about how we educate patients, about body language while educating patients, about allowing pauses for questions. So even though I was knowledgeable and experienced and I knew what was coming, I also felt extremely vulnerable. And I did have questions. I was so thankful that I had that upper hand, but our patients don't. Most of them don't, and they're counting on us to give them the very best care, the right care, and the right guidance, and the right education.